Hello, everyone. Welcome to GACD Implementation Science eHub Fundamentals Program. This is Module 2, Lecture 2A. I am Lijing Yan from Duke Kunshan University in China. I'm very happy to talk about who, what, when, and why, the importance of stakeholders. Here is our conceptual map of the fundamentals program, and module 2 is on stakeholder engagement. So we will be focusing on stakeholder engagement. The acronym for this module, SE, refers to stakeholder engagement. Here is the overview of this lecture. We will cover why is stakeholder extra important for implementation science, who are the stakeholders, and what is stakeholder engagement? When should we engage stakeholders and how to engage them? As you listen to this module, I would encourage you to think about an implementation research project you have done or plan to do, and think about the stakeholders relevant for your project. I will also use a project that my team has done with the acronym of CINEMA as an example, and I will review what CINEMA stands for shortly. So why is stakeholder important for implementation science? We know that there are many different types of sciences, such as basic science, that has a lot to do with lab and bench work. And there are clinical research, as well as implementation science. Compared to the other types of sciences, I would argue that stakeholder engagement is extra important or even more important. It is because implementation science, by its very definition, is all about people. This actually is a good occasion, a rare occasion we have in health research, where we can cite famous quotes from politicians, such as Abraham Lincoln in his famous Gettysburg speech had said that government of the people, by the people, for the people, shall not perish from the earth. So these three terms, of the people, by the people, for the people, actually apply to implementation research very well. What we do in implementation research is to close the no-do gap, is of the people, all different kinds of people that's relevant for our project. And it's done by the people, for the people, for their improvement of their health outcomes, for improving the implementation practices, for improving even health systems and policies. So even when we are working not at the individual level, maybe we're working to improve system efficiency, to engage in healthcare reform. All of these are about people. There is this also quote from the State Secretary, Colin Powell, who said, the bottom line in all of it is that in life, it's all about people. So I hope you agree that stakeholder engagement is very important for implementation science. And specifically, there are many benefits of stakeholder engagement. Stakeholder engagement can enhance implementation outcomes and effectiveness outcomes as well. As we know, the classic paper published in 2011 by Enola Proctor and others had identified many different dimensions for implementation outcomes, such as acceptability and appropriateness of the intervention or the innovation or the new practice, evidence-based practice that we hope to adopt, and its adoption cost and feasibility, reach, fidelity, and sustainability. Stakeholder engagement could provide improvement and enhancement for all of these outcomes, and effectiveness outcomes such as patient oriented health outcomes of improved health status, reduced morbidity and mortality. Stakeholder engagement can also lead to better selection and utilization of implementation strategies. So when we think about which implementation strategies to choose and how to use them, we should consider both feasibility and their impacts, which is the importance of these strategies. Different stakeholders may have different views on the feasibility and impact. Many of them may consider cost and feasibility more simply because of the work they're engaged in. And as implementation researcher, we need to be mindful of their particular perspectives and potential biases and have a balanced view on feasibility and impact. Stakeholder engagement can also facilitate future collaborative implementation research and practical efforts. This involves long-term ongoing partnership for both research and also to create sustainable and scalable effective implementation in the long run. So this icon has the threefold benefits in the loop to identify, to illustrate this point. So stakeholder engagement is so important, but who are the stakeholders? Let's do some linguistic exercise. Stakeholders, the official definition is that they are groups or individuals who can affect or are affected by an issue. So actually, to use simple terms to explain, stakeholders are someone who holds something at stake for what we are studying. So at stake means they have vested interests in what we do. So in other words, is that they're affected or they can affect others and the issue. So in terms of how to identify and classify stakeholders, Thomas Concannon published a paper in 2012, over 10 years ago, on a new taxonomy for stakeholder engagement. And in there, they proposed the 7 Ps framework, which is quite simple and easy to understand and remember because they all start with Ps, and even now it's still highly relevant. So the first P refers to patients and the public. So these are the people that we hope to improve their health outcomes, and we hope that the evidence-based practices can directly benefit them. And for providers, this is mostly referring to healthcare providers such as nurses, physicians, mental health counselors, pharmacists, etc. And it could also include organizations and community-based organizations as well. Purchasers are the people who are responsible for underwriting the costs of healthcare, or who have a strong motivation to support the evidence-based practice and interventions. And payers are typically insurers, including both public and private insurers, and also people with deductibles who pay. So this the difference with the purchaser is from the buying and paying perspective. And then policymakers are the fifth kinds of stakeholders. And they are usually people who work in the government or in a policymaking authority. Product makers include drug, device, and also technology providers, etc. And lastly, principal investigators refer to not only the principal investigators, but also other researchers and their team members and collaborators and funders. So the example that I refer to is called the cinema study. It stands for System Integrated Technology-Enabled Model of Care for Stroke Management in Rural China. So in this study, we identified the stakeholders according to the 7P framework. We focus on stroke patients and their family members because stroke is the largest disease burden, the #1 leading cause of disability and death in rural China. And the providers in our study mostly refer to village doctors who are the primary care providers in rural China, as our study has a primary care-based approach. But the primary care provision is integrated through the whole system. So we also include doctors in the secondary level facilities, such as county hospitals, as well as tertiary facility providers, such as specialists, neurologists. For the purchasers, it is the study site. We conducted our study in Nanhe County, Hebei Province in China. So the Nanhe County government is the main purchaser of the intervention. And the payers mostly are the New Rural Cooperative Medical Scheme, a social insurance program in rural China back then. And the policymakers are the Ministry of Health leaders at the central government level, as well as provincial, city, and county Department of Health leaders. The product makers for our particular intervention involving mobile health technology is in collaboration with China Mobile Smart Health Institute. So the leaders and technicians there are the product makers and important stakeholders of our research. And the principal investigators refers to our research team. So now we have understood the stakeholders, who are they and why are they important, and how do we engage them? Before we talk about the how, let's try to understand what is stakeholder engagement. So according to the paper by Concannon et al., stakeholder engagement is a bidirectional, so that is important. Bidirectional relationship between the stakeholder and the researcher, or it can be also the implementer. What's in the italics is added, not in the original paper. That results in informed decision-making about the selection, conduct, and use of research. So it refers to a bidirectional relationship. And there are, according to a paper by Melody Goodman and others, it refers, so there are 3 types of stakeholder engagement. One is called non-participation. Non-participation doesn't mean it's not engaged. It refers to outreach programs or education. So it is less bidirectional. It is less engaged than the other two types, referring to sharing information and knowledge with the stakeholders. And the other is symbolic participation. So the stakeholders are engaged in coordination and cooperation, more in a passive way compared to the third type, which is engaged participation. That includes collaboration, patient-centered engagement, and community-based participatory research. We will not cover CBPR in this session, but it will be covered in Module 2B. So these refer to 3 different types and also different levels of engagement, different depth of engagement. However, it doesn't mean one is necessarily better than the other. All of them have values, but we could say that the deeper the level, so the engaged participation usually have better effects in terms of its impact and long-term results, sustainability. So when to engage stakeholders? This is the EPIS framework proposed by Professor Greg Ahrens and others. And the EPIS framework refers to 4 different phases of implementation: exploration, preparation, implementation, and sustainment. In all of these phases, there are stakeholder engagement that we can do. For example, in exploration, involving identifying practice gaps, involving stakeholders in needs assessment. In the preparation, there are many different dimensions in understanding the setting, creating the intervention and implementation plan that we should involve with stakeholders. And in active implementation, the stakeholders can provide feedback and guide the adaptation and also help us to interpret the outcomes. In the sustainment, which is the long-term process, they can help with disseminating and also taking over ongoing implementation. So in one word, in a nutshell, stakeholder engagement should be conducted throughout the research from beginning to end. But this doesn't mean we should engage all of them at all times. We could prioritize which types of stakeholders to engage at different phases. So toward the last part, we will talk about how to identify and engage stakeholders. Identification of stakeholders is usually done through a stakeholder analysis. So there are 3 steps to identify stakeholders in the stakeholder analysis. The first step is to identify them. We usually do this through expert opinions, focus groups, or structure interviews. And we could also do snowballing sampling, meaning when we identify one potential stakeholder, we can ask them to refer other stakeholders to us. And the second step is to gather information. It's not enough to identify who they are, but we want to assess other key factors about these stakeholders so that we can confirm their status. So this is a paper by Professor Roberts, published in a book on health policy and health reform. So this is written in the policy perspective, but we can replace that with any other implementation initiative. So we want to gather information about their interests, which is their degree, or how much is at stake for them. We also want to evaluate their position, whether they support or oppose the initiative or the policy, and the extent or the intensity of their views. And then lastly is about their power, which is their potential power or capacity to influence the implementation or the policy. So after we understand their interest, power, and position, we then, based on number 1 and 2, then we can create a list of stakeholders for engagement. And this list may be updated through our implementation process. So it's not, it may not be fixed. So there is iterative process, and as we get new information. So once we identify them, we want to have specific ways to engage them. So these are the concrete or discrete implementation strategies for stakeholder engagement based on the ERIC list of implementation strategies by Professor Byron, Powell, and others. There are a total of 72 strategies, and over 10 of them are relevant to stakeholder engagement. They can fall into 2 large types, either aiming to develop stakeholder interrelations or to train and educate stakeholders. And the specific strategies include capture and share knowledge, identify and prepare champions, educate leaders, conduct education or education outreach, meetings and visits, consensus discussions, and also gather feedback or create advisory boards or form coalition. There are other strategies and innovations is also needed, and we don't have time to go into these specific strategies. And as you work on your project and as you work on engaging them, you will find ways to engage them through the specific strategies. Here are a few examples of what we did in cinema for stakeholder engagement. And we created community advisory groups involving multiple stakeholders, such as patient, family members, village doctors, and village leaders, opinion leaders, to give us feedback from beginning throughout the implementation and toward the end for dissemination. We have also held village-wide briefing sessions to inform and engage patients about the cinema model of care that we will do and what the village doctors will provide. We held educational meetings for village doctors and created social media WeChat groups to share the local knowledge and create mutual learning. And we also created benchmarking for the village doctors' performance and provided both financial incentives as well as non-financial awards to better engage them and to increase and enhance their performance. So, stakeholder engagement is very important. As we know, working with people, it's all about people, can be challenging and difficult. Here are some examples of the challenges. Stakeholder engagement can be time-consuming, and it may create conflicts with the timeline for stakeholders. They may want to start the intervention sooner, or for the researchers, even we may have a pressure to do things quickly. So we really need to be mindful of this challenge and balance the different points. We could also find ways such as rapid qualitative ethnographic analyses to provide feedback quickly and in a rigorous way. And there are other ways to do things quicker. For example, co-design workshop is also a good way to engage stakeholders in ways that is faster than individual interviews, for example. And there could be also superficial engagement by the stakeholders where they lack commitment or buy-in. And we really need to work hard to be aware of this and try to overcome it. Stakeholders often have competing priorities. This is a major challenge that we need to be mindful of and find ways to tackle. And stakeholders related to their competing priorities, they may value different outcomes. Some pay more attention to cost, some is more focused to feasibility or appropriateness, or sustainability. So we really need to be mindful of this. And there are 3 V's that we can end this module with: vision, valley, and victory. Vision is important to establish early on as a way to find common goals, to motivate and engage stakeholders. And valley refers to the low point, the long process and hard work of implementation, where we should try to better implement the evidence-based practices through input from stakeholders. And victory may not be the final success, but can be milestones that we have achieved along the way to celebrate and better motivate all stakeholders, the research team and all stakeholders. In summary, here are the key messages. Stakeholder is critically important, and there are 7 Ps to identify and classify stakeholders. All 3 levels of stakeholder engagement can be important, and we should identify and engage stakeholders throughout the entire process. Unite with vision, work through valleys, and celebrate victories. So this is the end of my sharing. Thank you for listening.